One challenge most women share is finding time to care for their own wellness. Memorial Hermann Sugarland sponsors a program to give women the tools to do just that. Courtney DeProm introduces us to Girls Night Out.
The Girls Night Out event happens bi-monthly. It's typically put on by Karen Chittybo, and it invites women out to enjoy wine, cheese, and hear what different physicians have to say about different health topics. Tonight we had two physicians speaking on osteoporosis and sports injuries. Dr. Kodali spoke on sports injuries, and Dr. Brian Heap spoke on osteoporosis.
The doctors took a moment to give HealthWise the highlights of their presentation.
Women are more predisposed to having knee problems, specifically patellofemoral knee pain, as well as even ACL injuries, and that's the way that the alignment of their legs kind of predispose them to that injury. In fact, there's also been some thought that the hormonal differences, women naturally having more estrogen, can actually predispose them to sustaining injuries in the knee, specifically anterior cruciate ligament injuries of the knee. That's probably more of a concern in our younger women, 30s, 40s, but really in any age group it's always an issue. General principles of preventing sports injuries include stretching. Adequately stretching before for about 10-15 minutes, focusing on avoiding knee injury. If you're a very active female that participates in competitive sports such as basketball and things like that, focusing on some basic mechanics of how you play the sport, how you jump, how you land after you jump, and there's a breadth of literature on the internet with respect to that. To avoid anterior knee pain or patellofemoral knee pain. Some women, a lot of women complain of that, and really to avoid that is to work on strengthening the muscles of around your knee, such as your quadriceps muscle and your hamstring muscles. In reality, when we strengthen the muscles around the knee, that takes a load off of our knee and minimizes how much load our knee takes, so it can prevent injury in the future.
Osteoporosis is thinning of the bones, which is a natural process as we age. The reason why women specifically are targeted when we discuss osteoporosis is because the vast majority of osteoporosis is seen in women. There are a lot of things that can be done to prevent. Most of those things are done early on in life, in the mid-20s and 30s, which include diet, supplementation of calcium, vitamin D, but also regular exercise, weight-bearing exercise that can be done in the 20s and 30s. Later on in life, absolutely supplementation is a huge benefit as well of calcium and vitamin D. For all adults, healthy adults and women at risk, you want to have a basic level of calcium and vitamin D, and then of course continue weight-bearing exercise throughout life. Any exercise is beneficial, first of all. Jogging, not classically weight-bearing, hiking, all of those are great activities, but specifically lifting small weights, repetitive small weights, 5-10 pounds. Usually in an older population, I would recommend having a physical trainer in order to find a healthy and a safe limit, but any activity that includes weights is going to be beneficial.
The hospital has a number of other upcoming events planned with women in mind.
We have a magnificent event occurring on Saturday, May 7th to display our newly remodeled breast center next door in our POB. We will have Dr. Song on hand to give tours of the new facility and enjoy mimosas, mammograms, and massages. The last event we have for the spring is on Saturday, May 14th. We will be hosting our second annual Women's Symposium from 9 to 2. It's a free event, and we will host many different physicians speaking about women's health. If you want more information about any of our programs, you can call 713-222-CARE. You can visit the website at www.memorialhermann.org. And lastly, for Facebook fans, you can go on to our homepage at Memorial Hermann.
For HealthWise, I'm Stacy Hawkins.